Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the stories of plastic surgery patients? We're here to explore those questions and get some of those answers with my guest, Tracey Khuc, on the Plastic Surgeon Podcast. Hello, my friends. Welcome back, and thanks to all the listeners and amazing feedback. We have had so much fun, and we look forward to more of your insights and suggestions. Please rate and review us on Apple Podcasts to help us get you more amazing content. On the Plastic Surgeon Podcast, we listen to real plastic surgery stories of triumph and pain from real patients and providers to further understand their motivations or why they would risk their life under the knife. I'm Dr. Sajan, and my guest today is the amazing, fabulous, fantastic Tracey Khuc.
Thank you.
We are here to talk to you about your journey, how we came to know each other, the procedure you underwent, and how it affected you. So Tracey is my amazing super VIP patient. Tracey underwent breast augmentation about 3 months ago. We're going to talk about that. But first, let's get to know Tracey. So Tracey, tell us where you're from.
I'm born and raised in Seattle, Washington.
And is your family from Seattle?
My family actually moved here from Vietnam.
Oh,
yeah,
okay.
and then it was about 6 years before I was actually born.
That's cool. And you went to high school, everything around here?
Yeah, I went to high school. I moved around a little bit, just like in a different city to Renton, and then I went to high school there, and then I moved back to around Seattle.
Cool. What do your parents do for a living?
My dad is really old, so he's retired. But he used to be a real estate agent. And my mom actually works at the jewelry store, so at the mall.
That's cool. Do you have siblings?
Yeah, I have 3 older brothers. So I'm the only girl and I'm the youngest, which makes me super spoiled. I was a spoiled brat growing up. I got everything I wanted. But I'm good now.
There's nothing wrong with that. And what do your brothers do? Are they in school or are they working?
My brothers all work. They all have like really good full-time jobs, and I'm really proud of them. They've come really far from where, like our family journey and stuff like that.
So were they, my parents were immigrants. They came here from East Africa. And so they had their whole story of coming here poor and building up with no money. So your parents, when they immigrated here from Vietnam, right, or straight, did they come with some resources? Did family call them? How did they get here?
My dad was actually he fought for the Vietnam War, and so the United States, they basically sponsored them to come here. So they had a little bit of help, but then again, like it wasn't much, and so my dad, I think he took like night school while doing like janitorial jobs and stuff, and my mom, they also took like English classes and stuff like that. And then eventually my dad went to like, I think community college first or something like that. And then got his degree and his real estate license and stuff like that. And then my mom worked her way up to be a really good salesperson. I'm really proud of her because she wins like these trips to, like, I think she took us to me and my dad to Panama one day, and it was all expense paid trip because she was a top salesperson in her whole company.
Awesome.
So she's amazing. I love her.
I'm not asking for the specific location, but is it a national brand that she works for?
She works for Sterling Company, so she works for K Jewelers.
Oh, that's cool.
Yeah. So if you ever need jewelry, hit me up. I'll hit my mama.
I could really relate to that. My parents came here. My mom worked for Mary Maids cleaning houses because they had no money. And my dad was a baker at Dunkin' Donuts. So he was to cut donuts at night. So it's a tough journey when our families come here, but they provide and give us so much opportunity that they never had. It means a lot. I'm sure that means a lot to you too.
Yeah, no, definitely.
So you went through high school, and what are you doing now?
I work at a law firm right now.
And what do you do there?
I work in IP, so intellectual property, like all the trademark and patent prosecution, basically.
Mhm.
And I'm basically working with attorneys and paralegals. It's a lot of filing, basically. I would just say that a lot of emailing and filing back and forth with other law firms and stuff like that.
So what's your title for the job?
It's called IP Transfer and Intake Specialist.
Mhm.
It's kind of a mouthful, but it sounds nice. So
How long have you been doing that?
about almost 2 years. It'll be 2 years in August.
Do you like it?
No, I love it. Like I love the company and stuff like that too. And they treat me really well. So I wouldn't want to be anywhere else.
Awesome. So you went to high school and you went straight to the job after that.
Oh no, I went to high school and then I graduated from UW in 2019.
Oh, you got a 4-year degree from there? In what?
In political science.
Oh, that's cool.
Yeah.
And then you went straight to this job from there.
Yeah. It took a lot of applying and telling myself that I'm not good enough. And then
What do you mean not good enough?
No, it's just like it's really intimidating. Like the job process after you graduate college, you're just like, I literally have no idea what I'm doing. And then you keep getting rejected from these jobs. And then finally I got like one call back and I was like, yes, it's all worth it.
You know, political science is one of those majors people do out of a passion. But sometimes, where do you go from there, you know?
Yeah. I actually wanted to go into like criminology and do work for the FBI because I really love the show Criminal Minds. So I wanted to like be behavioral analysis and stuff like that. But then I took psychology class and I did really bad in it. So I was like, no, I don't know if that's going to be my thing. And then, but I'm really passionate about like social justice and criminal justice and stuff like that. So I still wanted to eventually work, with like the ACLU or something like that. And I was like, I really like arguing with people. And so like,
you don't seem that way at all.
Really?
No, you seem very nice.
Okay, but when you get on like my bad side and you start like discriminating and just like doing all this stuff that is like not okay, I will come after you. So
good thing my surgery went good.
Yeah, no, it went amazing. So you're good. You're on my good side.
That's awesome. So is Criminal Minds sort of like I've seen Law and Order SVU? That's like the only law. Is that similar to that?
It's pretty similar, except this is more like murder and like it ranges. It's murder, what's it called? Kidnappings and like stuff like that.
Yeah.
Like all types of crime and not just like sexual assault and stuff like that SVU does. But it's my favorite show ever. So.
That sounds awesome. And so you think your long-term plans maybe to go to law school or something like that, or not really?
I'm thinking about that, but my brother's like, I know a lot of broke lawyers. Do you really want to be like? And I was like, you're right. Let me think about that. So
that's really true. Law is intense.
It's cutthroat. So I kind of just like dipping my feet in the law firm, and I really like it right now. I'm trying to become a paralegal, maybe. So
that's cool. And what made you want to have breast augmentation?
I've always had like pretty small breasts, and like in high school, I was like, maybe I'm a late bloomer. Maybe I'll like, my boobs will grow. And then
a lot of women feel that way. Yeah. So you just felt that you never developed enough?
Yeah. And like, a lot of people are like, oh, like, did you not love yourself before you got like, no, I loved myself. Like, just because I got breast augmentation doesn't mean I love myself more or less than, before. I just felt like I could do something. Like, it's my body. And if I want to do it, I'll do it. And like, I feel great. So,
And when you started thinking about breast augmentation, you felt that you didn't have enough tissue, and you thought there were ways of making that better. Did you know somebody who had it done before?
I actually didn't know personally until I posted like, oh, I'm thinking about getting a breast augmentation. And one of my friends actually responded. I was like, hey, my girlfriend actually got hers done and she got it at Real Doctor Seattle. Here's his Instagram.
I see.
And then I went, I was like, oh my God, this is my calling.
And where did you post that?
Oh, I posted it on Twitter.
Really?
Mm-hmm.
And she gave you my name, and then you started doing some research.
Mm-hmm.
And did you look into other doctors or not too much?
I think I looked into another doctor, but they only did phone consults, and I wasn't able to come in and try sizers or anything until the 3-week pre-op before the surgery. And I was like, that doesn't really make sense. So I went with you.
So they wanted you to pay and sign up without even knowing
they wanted me to basically pay and book my surgery before I even came in and tried on sizers or anything. And then they would have tried it on at the pre-op. And I was like, this doesn't seem, I don't know.
So, a lot of doctors, they don't do sizing. They basically decide the size. So there's basically 2 philosophies on sizing. Philosophy number 1, this is not me, but doctors will say, you know what? I am doctor. I will decide what fits you. I will measure your chest. I will use this equation and you will get this. And whether you like it or not, too bad. It's what fits your chest. Now, in my view, I think that's wrong.
Yeah.
And I'll call people out on that. I'm not scared. You know what? If you're going to do that, your patients are going to be unhappy. And those are the places that I think don't get patients anymore. I think it's old school, but there's a lot of new people still doing it because they learn old school techniques.
Yeah.
So my belief is this. A patient wants an augmentation. It's their right to pick their size. Now, the hard part with that is when you let the patient give you a range, and what I do is I let the patient give me a range, then I'll measure them and see what I can make work best. But when the patient picks their size, they're happier, they like it more, but the operation's harder. It's very easy to do a small size implant in any woman. When you go bigger, that's a lot more work. And some people, they don't know how to do it. They can't control their risks and they just don't want to deal with it. And that's not what I believe in. And I think that's why my practice, thank God, is so busy, or so many patients want to come see me, because I try to fit the operation to the patient. I don't fit the patient to the operation. Does that make sense?
Yeah. And I think what stuck with me the most working with you was because at our initial, after the initial sizing, because you told me anatomical, and I was like, I haven't really heard it or researched much on that. And then I was concerned about it for a little bit, but then I called you again. I was like, hey, I was thinking about round. And then you told me anatomical would work best with my anatomy, my amount of breast tissue and stuff. And but you said, this is my recommendation, but I want you to be happy. And if that's what you want, if you want to do round, you can actually, let's schedule a time for you to come in and look at the round again. But at the end of the day, I want you to be happy. And I was like, I love this. Oh my God.
That's really true. I put my patients first, and that's what it's all about at the end of the day. That's awesome. And so you found my name through your friend, and then did you go on the website and you went on IG, right? You saw the pictures?
Yeah, I went through all the pictures. I was like, they look so good. I want my boobs to look like that. And then I went on the website and I read more about your bio and stuff like that. And then I was like, yep, I'm going to sign up for a consultation right now. And it took me 3 months to get a consultation when I tried to book one last July or June or something. It was, yeah.
So why didn't you go somewhere else that was quicker? Why did you want to wait?
In my mind, I was like, I already know this guy is the best, so I'm just going to wait for the best. I had no doubt about it.
Thank you. Do it once and do it right. Yeah. That's awesome. And you did research, you found another practice, but you weren't, like you said, you weren't happy with their side. How did you find that other practice?
I think it was Real Self. I was on the Real Self app. Yeah. And then it had just the local ones around Seattle and Puget Sound and stuff like that.
And then you came for your consult. We met, and I talked with my patients. We go over the different options, and we did sizing. So when you were doing sizing, how did you decide what size was you liked more? Well, let's tell people first. How tell them about the sizing process. How did it go?
So I think when we first met, you asked me like, "Oh, what is your sorry, I talk with my hands a lot. What is your goal? End result." I was leaning towards a full C, small D. I don't think I ended up with. I went full on D.
What size were you before surgery?
I was like an A cup,
Mm-hmm.
basically.
Mm-hmm.
But now I think I measure like roughly 30 double D or triple D, something like that. So.
Do you think it's too big?
No, I love it. I have boob greener now. I wish I was bigger, but I would have fell over, with so much boob. But.
So with the sizing, my nurse took you back and they have you wear a bra. Mm-hmm. And in that bra, you put different sizers in there. Mm-hmm. And then you look in the mirror and feel out what you like. And when you were doing that, how did you figure out what you liked more?
I definitely took into account that a lot of people just said, you don't want to end up with boob greed. Like if you going towards the bigger number, go for that. I was like, okay, this seems like a little small, so I'll just knock off the 300. I don't want that. Mm-hmm. And then 400. I was aiming towards actually 400 to 450, but then I looked again. I was like, 400 cc didn't look as good as 450 cc on me in the mirror. And then she gave me 500 cc. I thought that was way too big. Mm-hmm. But then she asked for the range. I was like, oh, but I really like 450. And she said, oh, you just have to give the doctor the range. So I gave you the range for 450 to 500 cc. Mm-hmm. And that was when you said, oh, perfect, perfect range. I was like, really? And then you said 495 cc. At first I was like, that's a scary number. And mm-hmm. I had, cause with researching and stuff, I saw a lot of 350, 400,
those are easy. Those are little slam dunks.
and then I realized that, or your nurses told me that you lose pretty much 25, 50 cc or something like that going under the muscle. And what I saw on the sizers weren't as accurate because again, they're over my mm-hmm. Actual breasts, mm-hmm. so they'll look a little bigger than, what is actually inside my body. Mm-hmm. And then I was like, yeah, no, I trust this. I trust him. He went to med school. I didn't.
So then when I measured, so I got the range from the nurse and then mm-hmm. I measured you. And when I measure the width of the chest. I measure the width of the chest. I measure the distance from the nipple to the fold. I measure the distance from the sternum to the nipple. And we put all those together to find something in your size that works. Mm-hmm. Now, when we talk about implant placement, you can go two places, above or below the muscle. Now, I think when you put implants above the muscle, they end up looking like rocks in a sock. You ever seen rocks in a sock? Mm-hmm. It's bad. And so that's why I don't do it. Now, above the muscle heals a little bit quicker. However, long term, there's a higher risk, in my opinion, of capsular contracture or rejection. There's a higher risk and there's more sagging and ptosis. Now, below the muscle, initially, it's more painful.
Mm-hmm. Yeah, it was.
Yes. So let's talk about that. So surgery day came. You mm-hmm. must have been hyped.
Yeah.
Surgery day came. Mm-hmm. And then we went and we helped you do the surgery day came and then we went for surgery. How was that day? Were you excited?
I was really excited, but I was also very anxious just because I've never been under any type of anesthesia at all.
So you never had a surgery before?
No. The only thing I really went to the hospital for was to get my dislocated elbow popped back in.
How did that happen?
I was in gymnastics in high school and I did a back handspring and it just popped while I was on my arms. Yeah.
That must have hurt.
Yeah, no, it definitely hurt. But then, yeah, not even for wisdom teeth. I don't have wisdom teeth apparently. I don't know. So, yeah, that was my first time really in a serious setting like that.
And people often ask me, so doc, I haven't had anesthesia before. Are you going to get a test for me? So this is how we determine that. If you're a young, healthy person, young being for us less than 50, who has no medical problems, then your medical history and physical examination that we do is what we need. And we're comfortable moving forward with that. And one of the reasons for that is because the anesthesia drugs we use are so safe. Now, if there's red flags, like for example, if your family has a history of having bad reactions to anesthesia, if you have a history of a heart issue, lung issue, asthma, a sleep apnea, then we order additional testing. But for a young, healthy person who has no medical issues, that person doesn't need any workup before surgery. Does that make sense?
Yeah, no.
And so we did the surgery. You were hyped. It went amazing during the operation. And then you remember waking up in the surgery center?
I do remember waking up in I think they wheeled me out, but I was crying, I'm pretty sure. I was crying about how much I loved my best friend.
Really?
So Quinn, if you're listening, I love you, girl. Thanks for driving me at I think she drove me at 5 a.m. or something like that. Yeah.
And then when did you start feeling the pain?
I think it really started to settle in when I got home, maybe an hour or two later is when I was like, oh man, this is serious pain. And it felt like an elephant sitting on my chest. If I were to ever experience an elephant sitting on my chest, I think that is what it would feel like.
And we gave you Oxy for pain. Did you take that?
Yeah, I took all of it. I think I definitely needed that.
Did it help you?
It helped, but I wish there was something stronger because I could still feel if that was what it felt like after the Oxy and other medication, I do not want to know what it felt like without medication. I would not wish that pain on my worst enemy, but it was worth it. So.
Not even your worst enemy?
Not even my worst enemy.
What about your haters?
No, because I'm a nice person.
So during the surgery, I do a lot of numbing. So that's why typically people won't feel pain for about 4 to 6 hours after. So that's why you probably felt it more and more when the numbing wore off. The Oxy does help, but you're right. It doesn't take away all the pain. Did you look at your breast at all that day?
I think just in the mirror a little bit. I didn't take anything off, but just seeing that I kind of had cleavage now at this point, I got super excited. But I kind of just left it alone for the most part that day because I think I was more focused on trying to get rid of the pain.
And then you came for your post-op. How were things getting better by then as far as the discomfort?
I think my post-op was, what was that? Monday. So I think that was actually getting bad. I think the third and fourth day were probably the worst days in pain level. And then I think by a week and a half to 2 weeks was really when it was okay, I'm feeling kind of normal and getting my range of motion back. How
did you feel when you saw your new breast for the first time?
I was so excited. I looked down instead of seeing the floor straight away. I saw boobs there. So I didn't think I could get better until I saw my boobs. I was like, wow, I'm so powerful now that I have boobs.
Yeah, you feel it gave you more confidence.
I see, that's the thing is I don't know if I would, because I was already pretty confident before, but I just think this just gave me a boost of some pre-workout or something now I can't stop taking pictures. Now I'm going out and doing photo shoots and stuff. So,
what are you doing photo shoots for?
I've been doing boudoir photo shoots and stuff like that.
Yeah.
I'm I finally have lingerie I can fit my boobs in now, so.
Do you feel people look at you different now?
I think I've always been super transparent about things that I get done.
Mhm.
So I feel like having breasts now kind of matches my big personality, if that makes sense.
Yeah.
Like at first when I had small breasts, I was like, oh, she's cute. Yeah, Tracy, so cute. And then now it's like, damn, Tracy, like, yeah, you know.
So who says that? Damn, Tracy. Who says?
I just imagine people would say that when they see me, you know.
Yes,
so.
yes. Yeah. Are you dressing differently now?
I've definitely bought a lot more revealing clothes with the cleavage and just like stuff that I normally wouldn't fill and like avoided buying from, just because I had no breasts to like wear them, you know. So
are you happier when you look in the mirror?
Yes, I would say so. Yeah. No, I honestly didn't think I could love myself more than I did before. But then I looked in the mirror and I saw these and I was like, yep.
So sometimes people say, you know what, that you're doing implants because you don't love yourself. And you just told me you did love yourself before. So how would you respond to somebody who says, you know what, I want this, but people are going to think that I don't love my body or love myself? What would you tell that person?
I would say like how I dealt with this was that I love myself and my body enough to do whatever I want with it, you know? And I think that it's okay to want to do plastic surgery on yourself, you know, as long as, you know, I mean, I'm still the same person. My character is the same as I was before, you know? And I think self-love comes in a lot of different different ways. Is that how to explain it? Like
people express love differently to them about themselves and towards others.
Exactly. And I don't think that just because you got something done on your body, it doesn't mean that you don't love yourself. Like
So, you know, this is something I think about when people say plastic surgery is superficial, bad, all this nonsense that I think. How is surgery different versus getting lashes done, getting hair done? I mean, the risks are always different. What would you say? What do you think about that?
I mean, if people want to say like, oh, if you didn't love yourself or you didn't love yourself before you got your blah, blah done, then they could say the same as people who pay to get, you know, lashes, you know, lash extensions. Like you didn't love your lashes before, you know, and like, I think it's the same. Like you're doing something to your body because you want to and because you love the way you look with it, you know?
And you know, now some like cultures, like, you know, although I'm from East Africa, you know, my family is Indian, and some cultures have things about surgery and stuff like that. So you're Vietnamese, as you said. Did your parents know about this, or what did they say?
So funny story. I actually told my sister-in-law first, because she has seen me at my wildest. She's comfortable with, you know, my personality versus my really conservative family that's like, what went wrong with her, you know? Really? But my sister-in-law, I trust her with everything. Like I tell her secrets. Like I only grew up with 3 older brothers, you know? I had no like sister to talk to. So I told her one night when I was really drunk, I was like, hey, I'm really drunk. I have something to tell you. She's like, oh, do you need me to pick you up? I'm like, no, I'm getting my boobs done. I just
you called her?
I texted her. I was like, I'm getting my boobs done. And like, I'm not telling my brothers, obviously, but I'm telling you because I trust you and I love you and stuff like that. And then when I actually got my surgery date.
What did she say at that? Did she call you?
She was really supportive. She's like, wow, really? I wish I had your boobs. Like, I cannot handle these, how big they are. I was like, okay, we'll trade then. But she was really supportive. And then when I did get my surgery date booked, I told her like, hey, can I stay with you and my brother for a week? Can you guys, since you guys work from home, can you guys, take care of me? And then that was when I gave her the okay to like, tell my brother at that point, since he's obviously going to take care of me too. And he was really cool about it too. Like he didn't really say much. And then I guess my oldest brother found out, and he was trying to talk me out of it, I think. So I got the heads up from my sister-in-law, and she was like, hey, by the way, blah, blah, blah knows about your boob job. He wants to take you out to dinner and talk about it. I was like, and so my brother texted me, and I was like, oh, yeah, sorry, I'm busy. I can't go to dinner with you, which was like the day before my surgery. So he couldn't talk me out of it anyway. But then my parents, I actually told my mom the day of my surgery after it happened, because my mentality was, it's better ask for forgiveness than permission. But then because I FaceTimed her. I wish I recorded it. I FaceTimed her. I was like, hey, Mom. She's like, what? I was like, so I got my boobs done. She's like, what about your boobs? I was like, I got them done. She's like, what? I was like, yeah, I got my boobs done. And she's like, obviously I'm translating this from Vietnamese, but it's so much funnier in Vietnamese. She said, oh my God, what did you do?
Oh no.
and then, because I've always been very outgoing and just I wouldn't say rebellious, but my parents are really concerned. You would not think I came from my parents. And when I got like piercings and tattoos, they were just like, my mom was like, I gave birth to you so perfect and you just ruin it with piercings and tattoos. And so this was the mentality that, she had going on in her head. But then she FaceTimed me again later and was like, I am so mad at you. Like, but I love you. But I'm so mad, but I love you. And then she ended up being really supportive and asking me like, or telling me, hey, like, be careful. Tell your brother to grab things for you, blah, blah, blah. Like, don't mess up your implants. And she actually drove me to one of my post-ops too. So that was exciting.
Did any of them ask about my name? Like, who is this person doing it? Or no, did they trust your judgment?
I think they trust me, especially since I already got it done. So I can't really rewind the time, and they can approve of you doing it. Yeah, no.
What did your dad say?
My dad actually didn't say anything. My mom was the one that told my dad, because I was like, Mom, you told Dad? She was like, well, what am I supposed to say? You're gone for a week at your brother's. I had to tell your dad about your surgery.
You live at home.
I live with my parents. So then I went to my brother's because my mom would be at work. And obviously I don't want my dad to take, in that state. But he kind of just didn't say anything. Even when I got home a week later, he was like, hey, nice to see you. I'm like, hey, and I just went straight to my room. But then he would ask me to do stuff around the house, like within the 1 month mark where I'm not supposed to like lift stuff. And I was like, oh, Dad, like I can't lift anything. I had surgery. He's like, oh, okay, then I'll do it. It's okay. So
are you pretty close to your dad?
No, not really.
Who are you closer to, your mom or your dad?
My mom. Yeah. No, I'm my mom's best friend. Yeah.
Why would you say you're not as close to your dad?
I don't know. I guess I just can't relate to him on like a girl level, And like my mom is a lot more understanding. That's why I was okay with telling her about my breast job or my breast augmentation. But yeah.
Well, if you're looking back at your journey now, if there was one piece of advice you could give someone who wants to do this, what would you tell them?
I would say just do it. Like Nike, just do it. I think it's changed my life for the better. I don't have any regrets at all. It's definitely something that you need to research to the best of your ability, and make sure this is something you're 100% about, and just go for it, because you never know, it'll change your life.
Mm-hmm. And I appreciate your kind words so much about me. But sometimes when we look back at our journeys, we'll think, hey, I could have done this differently. Is there anything you wish you would have done differently than the way you did it?
Maybe like, no, I can't think of any.
Were you going to say go bigger?
Yeah, I was gonna say go big. Go big or go home. That was my mentality.
Mm-hmm, mm-hmm. When you talk about sizing, I'll just touch on that. What's a cup size? And that's always debatable, right?
Mm-hmm.
So I would say on average about 290 cc's, depending on who you ask, and the type of implant is about 1 cup on top of what you have. But when you measure, it's different everywhere.
Mm-hmm.
When women go to Nordstrom and get measured, it's a lot smaller than when they go to Victoria's Secret.
Mm-hmm.
So your double D size is...
Because I obviously Googled how to, mm-hmm. measure your bra size. And they said it's the band size, the difference between your band size and like the actual bust size.
Mm-hmm.
And my band size now is 30. And then it's 36 is the bust size.
Mm-hmm.
So the 6 inches would make it technically like a triple D.
Mm-hmm. Mm-hmm.
But I think it's still a little, like, still needs settling to do.
Mm-hmm.
So we're definitely going to measure it again soon.
Mm-hmm. Awesome. Thank you so much for being our guest today, Tracey. I have learned a lot from you. I know your experience and journey will teach our listeners what to expect as they start their own cosmetic and plastic surgery journeys. I appreciate your time, and I'm honored to have you as a patient, and I would say as a good friend. Thanks for listening to the Plastic Surgeon Podcast, and please rate and review us on Apple Podcasts for more great content. For my live surgeries and Snapchat and adventures throughout the week, catch us on all social media at Real Dr. Seattle. Bam, what?